Thank you very much, Chief Makonjola. Distinguished guests joining us both physically and online, partners, ladies and gentlemen of the press, I would like to adopt any existing protocols that have been laid by Chief Makonjola. I want to introduce us to Grand Challenges Nigeria. Today's event crystallizes a year's work for Grand Challenges Nigeria in defining why we exist, the impact we hope to make, and how we will go about this assignment. To start, I would like to offer some context on what we mean by a grand challenge. The concept of grand challenges is traced back to the year 1900, when the renowned mathematician Dr. David Hilbert presented a list of 23 unsolved mathematical puzzles that focused the efforts of mathematicians for the entire 20th century and beyond. Hilbert's grand challenges framework has since influenced some of humanity's most ambitious projects, from placing a man on the moon, to eradicating polio, to mapping the human genome. In fact, the well-known Millennium Development Goals and Sustainable Development Goals, as well as efforts to develop a COVID-19 vaccine, also follow this framework. So, what is the framework of a grand challenge? Grand challenges are not merely routine research questions. They are visionary directives that demand achievable solutions to exceptionally difficult problems and produce outcomes that potentially affect millions, if not hundreds of millions of lives. Grand challenges require a multidisciplinary approach, mobilizing research across various fields. Grand challenges capture the popular imagination and thus garner political support. So, by way of history, in 2003, Grand Challenges in Global Health was proposed as a research initiative launched by the Bill and Melinda Gates Foundation in search of solutions to health problems in the developing world. Starting in 2010, funders in many countries began to establish Grand Challenges initiatives, including GC Brazil, GC India, South Africa, and GC Africa, which is a Pan-African program, among many others. These GC initiatives work independently and together as part of the Grand Challenges network of partners who use the model to accomplish dual objectives. First, identifying and supporting innovative solutions to the world's toughest problems, while at the same time fostering and strengthening an innovation ecosystem in places where we will have the most impact. So Grand Challenges offers a model that other funders and governments, particularly those in the low and middle income countries, can use to dedicate more resources to scientific discovery and innovation, particularly in health and development. Although the records show that individual Nigerian innovators, about 600 of them, have benefited from existing Grand Challenges initiatives, there is no Grand Challenges Nigeria focusing on the unique local contexts of Nigeria, the local issues and needs that we face daily until now. Today, that changes as Nigeria joins the Grand Challenges network of partners, which together seeks to intentionally build and strengthen communities of innovation funders and support and connect grantees to a global network that boosts their potential. It is therefore with great honor that I introduce the Grand Challenges Nigeria, a national project of the federal government of Nigeria, anchored in the Office of the Vice President and the Federal Ministry of Innovation Science and Technology. Grand Challenges Nigeria is implemented by the Nutrition Society of Nigeria, which, having raised the initial funding, has garnered the support of government and non-government partners for seeding, scaling up, and sustaining innovations in health and development in the country. These partnerships align with national priorities and leverages Nigeria's existing strengths and strengths in science and innovation. Our mission in Grand Challenges Nigeria is to build a platform for jointly identifying strategic areas for investment where Nigerian innovators, researchers, practitioners, and others can unite to address local grand challenges. As I get to the end of my speech, allow me to illustrate our approach with a simple yet profound example, which is the evolution of the mechanical door lock. We all have door locks in our homes. The door lock began as a simple solution to a universal challenge, the need for security and privacy. This modest intervention originated around 2000 BCE. It was called the pin lock. And it was originated in ancient Egypt, here in Africa, where, by the way, a lot of good things happen. For example, like man, we originated here. And so, initially crafted from wood, this pin lock evolved over the centuries with refinement from other innovators, until we now have the sophisticated locking systems that we rely on today. It is remarkable that this seemingly simple idea has shaped the course of human civilization. Similarly, Grand Challenges Nigeria, though in its fetal stages, aims to drive transformative change and will harness innovation in country and build a brighter future for our nation, such that with sustained national support, this initiative will grow, adapt, and scale just as the door lock did, expanding from a simple concept into a lasting, powerful solution that safeguards our collective future. Here at this event, various experts will present you with difficult developmental issues that we are facing in Nigeria, and they will use the Grand Challenges framework to look at collaborative innovation that we can do to address these issues. We will also announce the first request for proposals that will define the first of the several issues that will galvanize efforts for Nigerians. We hope to leave you inspired. Let me end by thanking all of you for being here today to lay this foundation with us. On behalf of the Nutrition Society of Nigeria and the governing board of the newborn Grand Challenges Nigeria, we extend our immense appreciation to the Grand Challenges network of partners for the welcome and support accorded us from inception. Dr. Moses Alobo and Dr. Fatih Badien flew in to join us in person. We appreciate you. Special thanks must also go to the Office of the Vice President and the Federal Ministry of Innovation, Science and Tech and Innovation for their incredible support as they worked tirelessly with the Grand Challenges Nigeria team towards the success of this launch. I must mention Mrs. Uju Anwuka, the special assistant, the special advisor to the President on Public Health, and I must thank Mr. Adebayo Adeyemi, the Director, Health, Biomedical Science, Federal Ministry of Innovation, Science and Tech, and their team. Thank you very much. I invite you all today to join in this work of fashioning just one more key to the doors that Nigerians must walk through. Thank you very much. You are welcome.